How do stress ulcers differ from other ulcers? Imagine your body under extreme pressure, like after a serious injury or illness. During these times, your stomach can develop tiny sores called stress ulcers. These are different from other common ulcers you might hear about, like peptic ulcers, which usually develop over time. Stress ulcers happen suddenly, often within hours or days after a major health crisis, especially in people who are critically ill and in intensive care units. They tend to be multiple and shallow, spreading across the stomach lining and sometimes reaching into the lower esophagus or the beginning of the small intestine. In contrast, peptic ulcers are usually deeper, more localized sores that develop gradually over months or years. They are most often found in the stomach or the upper part of the small intestine and are linked to infection with the bacterium Helicobacter pylori or long-term use of medications called non-steroidal anti-inflammatory drugs. The cause of stress ulcers is tied to severe physiological stress, such as major trauma, burns, sepsis, or critical illness. This stress causes changes in blood flow and acid production in the stomach, which can damage the lining and lead to ulcers. Peptic ulcers, on the other hand, develop because of bacterial infection or medication use that weakens the stomach's defenses over time. Because stress ulcers are linked to critical health events, they tend to appear quickly and are often associated with bleeding. Symptoms can include vomiting blood that looks like coffee grounds, passing dark tarry stools, or signs of anemia like pale skin and shortness of breath. Peptic ulcers can also bleed, but bleeding is less common at the initial stage and usually occurs later if untreated. In terms of risk factors, stress ulcers mainly affect people who are very sick or undergoing severe physiological stress. They are rarely seen in healthy individuals. Peptic ulcers can affect anyone, especially those infected with Helicobacter pylori or regularly taking NSAIDs like ibuprofen or aspirin. While psychological stress can worsen peptic ulcers, it is not a direct cause of stress ulcers. Treatment for stress ulcers focuses on reducing stomach acid and preventing complications like bleeding, especially in hospitalized patients. This often involves medications that lower acid levels and careful monitoring. Peptic ulcers are treated by eradicating the infection if present, stopping NSAID use, and reducing acid production. Both types of ulcers can heal with proper medical care, but stress ulcers can be more dangerous because they occur in people already facing serious health issues. To sum up, stress ulcers are a specific type of ulcer caused by severe physical stress, appearing suddenly in critically ill patients, and tend to be multiple and shallow. Peptic ulcers develop more slowly, are linked to bacterial infection or medication use, and are more common in the general population, both requiring medical attention, and if you suspect an ulcer, it is always best to consult a healthcare professional for diagnosis and personalized treatment.